Do14 is on the posterior midline, below the spinous process of C7 in a depression. Bladder 35 is 0.5 sun lateral to Do2.
Large intestine 20 is located in the nasolabial groove, level with the midpoint of the ala nasi. The ala nasi is the nostril. So find the superior border of the nostril, the inferior border of the nostril, hence the midpoint, and come out into the nasolabial groove. Do20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do20 is located 1 sun posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other do points, so don't be tempted to go further back than 1 sun posterior to that midpoint. Heart A is on the palmar aspect of the hand, in the dip between the heads of the 4th and 5th metacarpals, typically where the tip of the little finger rests when a loose fist is made.
Heart 9 at the radial nail point of the little finger. Going to feel for the flare. Look at where the proximal and radial borders meet. Look at where the nail bed is and put my point in.
Liver 3 is located on the dorsum of the foot in a depression distal to the junction of the bases of the 1st and 2nd metatarsals. You can palpate up this nice cleft between the 2 bones. Don't go right in between the 2 bases, just go a little bit more distally into where there's a nice dip. It's almost on a level with spleen 3. The easiest way to locate liver 8 is to fully flex the leg, place your finger on the medial end of the popliteal crease, open the leg up to 90 degrees and then travel slightly superiorly, that's up towards the head, a very small distance until you fall into a nice dip that is anterior to the tendons of semitendinosus and semimembranosus. It's about 1 sun anterior to kidney 10. Liver 11 is located 2 sun directly inferior to stomach 30 on the medial border of the muscle adductor longus.
Kidney 10 is at the medial end of the popliteal crease, in between the two tendons of semitendinosus and semimembranosus. Locate this with the knee slightly flexed. Kidney 10 can also be found in the prone position. To bring the two tendons of semitendinosus and semimembranosus into relief, you can ask the person to push up against your hand against resistance. This will bring the two tendons into relief, and you can palpate in between them easily.
Spleen 5 is located in a depression which is anterior and inferior to the medial malleolus. Trace along the anterior border of the malleolus and the inferior border, and then palpate whilst you articulate the foot. Feel for a nice dip. Spleen 5 is in that dip. Spleen 6 is located 3 cm superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Spleen 10 is located 2 cm superior to the superior border of the patella in a tender depression on the height of the muscle vastus medialis. We know the patella is 2 cm long, so we can use this to calculate how high up the leg this point should be. A common mistake is to mark this point too far anterior or medial. A good location tip is to have the person press their leg down into the bed, which will bring vastus medialis into relief, and you should be able to palpate the depression in the height of it that forms spleen 10. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella. Gallbladder 41 is located on the dorsum of the foot in a depression distal to the junction of the bases of the 4th and 5th metatarsals. If you articulate the 2 metatarsals, you'll be able to feel a nice groove in between their shafts. Gallbladder 41 is located lateral to the tendon of extensor digitorum longus, little toe branch. If you extend the toe, this will bring this tendon into relief.